There are certainly a few bladder studies that I think that are being presented that are quite interesting and intriguing. I'd started talking about a new HER2 targeting agent. This is Trastuzumab deruxtecan, which is given in combination with nivolumab, an anti-PD-1 antibody. Showed some encouraging preliminary efficacy results, although in a fairly small study, but more than 30%, I believe it was like 34 or 36% of patients with high HER2 expression had an objective response to this combination therapy, and these were patients that were mostly previously pretreated with other therapies. Other trials I'm excited about at this conference include presentation of the initial neoadjuvant data for Enfortumab vedotin as part of cohort H of the EV-103 study. This was, just to review, the EV-103 trial is a multi-cohort study of Enfortumab vedotin monotherapy and also in combination with other agents. This cohort H investigated Enfortumab vedotin with up to 3 cycles in patients with muscle-invasive urothelial cancer who were intended to undergo radical cystectomy. And among the 20 or so patients evaluated in this study, the pathologic complete response rates at the time of radical cystectomy were in the 30 to 40% range. So it was, again, it was 36%. And this is, comparable to what we expect to see with platinum-based or specifically cisplatin-based chemotherapy in this space, and for a drug that's better tolerated than cisplatin-based chemotherapy. So these results are certainly encouraging and inform the development of future trials of Enfortumab vedotin in the perioperative space, and there are a few larger phase 3 studies that are coming. I would also say that presentation of the trophy study, cohort 3, was interesting. This is the combination. This is also a multi-cohort study, but of combinations of Sacituzumab, govitecan, the other main antibody drug conjugate used for urothelial cancer. This cohort investigated the use of Sacituzumab govitecan in combination with pembrolizumab in patients refractory to platinum-based chemotherapy. And the objective response rates an objective response rate, I should say, of 34% was observed in an initial subset of patients, of about 20 patients, which again is encouraging for the further development of this combination. Finally, I should mention something from the Prostate Day, which was earlier, and particularly interesting and potentially practice-changing study was the ARASENS study, in which patients with metastatic hormone-sensitive prostate cancer were randomized to receive either a combination of Lupron or androgen deprivation therapy, basically, with docetaxel chemotherapy and Darolutamide versus androgen deprivation therapy with docetaxel and placebo. And the triplet therapy arm, the ADT with docetaxel with Darolutamide, was shown to improve overall survival in patients treated with the triplet therapy as opposed to patients treated with ADT and docetaxel alone. These results are very encouraging and potentially practice-changing for a subset of patients with prostate cancer, and so I think was really the highlight of the studies presented during the prostate portion of this conference.